California, for 5 minutes of questions.
Thank you, Mr. Chairman. I'm sorry you all had to go through that. That was a lot of conspiracy theories and wild accusations, which we know have been debunked by medical science. And we should be clear that vaccines work and save lives, and they have millions of lives in this country. Now, it's really unfortunate that we're actually here having this hearing trying to poke holes and cause more vaccine hesitancy amongst the public. But we know that we're here because committee members on this committee have demanded that we have this hearing, and we continue to cave and give those members everything that they want. Now, we also know that we have a member of this committee that just actually made some comments, who's been on social media, demanding that we hold this exact same hearing. This is the same person that we know that has, on countless posts, has spread misinformation, encouraged parents to refuse routine vaccinations for their children, which you just heard, by the way, and even compared our pandemic efforts responses to the Holocaust. I want to just actually read something which is in the public record. I'm not saying anything that's not in the public record. That a member of this committee actually said, the same person that is actually attacking vaccines, said that vaccinated employees get a vaccination logo, just like the Nazis forced Jewish people to wear a gold star. I want to read that again. Vaccinated employees get a vaccination logo, just like the Nazis forced Jewish people to wear a gold star. That is the level of insanity and attacks that we are having here as we actually debate the lives saved around vaccinations. Now, this same member has also held shadow public hearings promoting ideas that COVID is a bioweapon to target people of specific races and that vaccines, and I quote, cause turbo cancers. I want to read you this quote, and it's again in the public record at a hearing. Have the COVID vaccines resulted in an increase in cancers, and are turbo cancers real? Now, Mr. Chairman, this is, in my opinion, just insanity. We know that's not the case. Dr. Marks, can you clarify once again for the American people, do the COVID vaccines cause turbo cancers?
I'm a oncologist that's board certified. I don't know what a turbo cancer is. It was a term that was used first in a paper in mouse experiments describing an inflammatory response. We have not detected any increase in cancers with the COVID-19 vaccines.
Thank you, and I thank you for correcting the record.
May I just add something here? I do need to apologize to the 1,000 or so parents of children who are under 4 years of age who have died of COVID-19 who were unvaccinated because there were deaths and are continuing to be deaths in children, and that is the reason why they need to get vaccinated. Thank you.
And I agree with you 100%. And the fact that we are now having parents that are choosing to vaccinate their kids less than before because of all of the attacks on vaccinations is shameful, and it's shameful that members of Congress continue to put down vaccinations as an opportunity to get our communities healthier. And Dr. Marks, I want to thank you for the work that you did. My mom passed away to COVID-19. My stepfather passed away due to COVID-19. Both would have taken that vaccination in an instant if it was available to them. And so anytime that folks, especially folks on this subcommittee on the pandemic, attack vaccines, it's personally insulting to all the families that have actually lost loved ones. We've saved millions of lives because of the vaccine, and it's unfortunate we keep causing this harm. I just want to say, lastly, that Dr. Marks, do you agree that additional lives would have been saved? The lives that the folks that were not vaccinated that we lost, over a million, obviously, in this country. Wouldn't a vast majority of those lives have been saved had we had the vaccine and they'd been vaccinated?
Multiple studies show that 80 to 85% of the deaths that occurred were in unvaccinated individuals. So if we would have been able to reach a higher vaccination rate, it's likely that we would have had fewer deaths. And countries where they reached higher vaccination rates had fewer deaths per capita.
Thank you, and I encourage this committee and all members of Congress to encourage vaccinations across this country to save more American lives. With that, I yield back.